Obsessive-Compulsive Disorder, known as OCD, intrusive thoughts, got you stuck. Discover what it really is and some management strategies to finally break the cycle and claim your life. Welcome to Peace Unplugged, the podcast dedicated to looking at mental health issues. Today we're diving into a condition that is often misunderstood and frequently gets trivialized. That is obsessive compulsive disorder, or OCD. It is a serious, complex condition and sometimes debilitating. But with the right knowledge and tools, there are ways to manage it. Listen through to the end of this podcast where I'll reveal 5 techniques to manage. To truly understand OCD, let's start with its history. The concept of recurring and unwanted thoughts and behaviours isn't new. It goes back as far as the 17th. Cases resembling what we now call OCD were being described. For example, the Oxford scholar Richard Burton, in his 1621 work, The Anatomy of Melancholy, recounted a case of a man afraid he'd speak out aloud unaware something indecent during a sermon. However, modern concepts began to take shape in the 19th century. Many figures contributed, but the German psychiatrist Carl Friedrich Otto Westphal is often credited with one of the most significant early distinctions. In 1877, Westphal published descriptions of what he called Zwangsvorstellung, held idea of essentially capturing the feeling of an idea being imposed on the mind, which is a core feature of obsession. This work and the later translations of the term in English as obsession or compulsion paved the way for our current diagnosis label, obsessive compulsive disorder. So what is OCD and what isn't OCD? At its core, OCD is a mental health condition characterized by a cycle of obsessions and compulsions. Obsessions are recurrent, unwanted, distressing thoughts, images, or urges. They are intrusive, meaning they feel alien. They cause intense anxiety and fear or disgust. Common themes include fears of contamination, aggressive or horrific impulses, or the need for symmetry and order. Compulsions, on the other hand, are the repetitive behaviors or mental acts an individual feels driven to perform in response to an obsession. The purpose of the compulsion is to reduce anxiety caused by the obsession or to prevent a dreaded perceived event. This is why you see repetitive checking, excessive washing, ordering, or repetitive mental rituals like counting or praying. The relief, of course, is only temporary and the cycle quickly starts again. So, crucially, what is OCD not? OCD is not simply being a neat freak, organised or detail orientated. Many people use the term OCD casually, saying things like, I'm so OCD about organising my desk. But true OCD is a debilitating, anxiety-driven cycle that consumes significant time, often more than an hour a day, and causes significant distress and impairment in daily life. It's also not a lack of willpower. People with OCD usually recognise that their obsessions are irrational or excessive, but they are driven by intense distress and the fear of what might happen if they don't perform the compulsion. Here's some approaches to treatment options. The good news is that OCD is highly treatable. The gold standard for treatment typically involves 2 main approaches, often used in combination. That is psychotherapy and medication. Let's look at psychotherapy. The most effective psychological treatment in a specific type of CBT called exposure and response prevention, or ERP. ERP involves 2 parts. Exposure, where the individual is gradually exposed in a safe way to their fear or to their feared obsession or situation. For example, touching a doorknob they fear is contaminated. And response prevention, where they are then prevented from performing the corresponding compulsion. For example, they cannot immediately wash their hands. Over time and with practice, this helps the brain learn that fear is unfounded and that the compulsion is not necessary to prevent disaster. On to medications. Certain medications, a particular class of antidepressants, known as SSRIs, or selective serotonin reuptake inhibitors, have proven effective. These work by helping to regulate the neurotransmitter serotonin in the brain. They are often used alongside ERP, especially for moderate to severe cases, to help reduce the intensity of the symptoms and make therapy more manageable. Okay, so now let's look at 5 ways to manage the condition. Beyond the professional treatment, there are many self-management strategies that can help provide people live fuller and more meaningful lives with OCD. Here are the 5 effective ways to manage the condition. Embrace and practice ERP principles, even outside of formal therapy sessions. Continuously practicing response prevention is key. Whenever an intrusive thought or urge arises, try to label it as just an OCD thought and delay, minimize, or completely stop the compulsion. Start with small, manageable challenges to build your tolerance for uncertainty and anxiety. Identify and track your triggers. Pay attention to what situations, times of day, or type of stress tends to wrap up your obsession. By identifying these triggers, you can anticipate your compulsive urges and apply your coping strategies proactively, rather than waiting until the cycle is already in full swing. Learn mindfulness and relaxation techniques. OCD thrives on anxiety and stress. Integrating stress management practices like mindfulness, deep breathing, or meditation can help. Mindfulness, in particular, teaches you to observe your thoughts and feelings, including the obsessions, without judgment or reaction, essentially interrupting the link between the thoughts and the compulsive response. Limit reassurance seeking. Seeking reassurance, whether from a friend, family member, or even yourself, by repeatedly checking in your mind, is a form of compulsion. It provides temporary relief, but ultimately reinforces the idea that the obsession is a real threat that needs to be neutralized. Work actively to resist the urge to ask for reassurance about your fears. Prioritize self-care and ensure you maintain healthy lifestyle habits. Regular sleep, a balanced diet, and consistent physical exercise are not cures, but they are crucial for regulating mood, reducing baseline anxiety, and giving you the mental resilience you need to fight the OCD cycle. Consistent daily routine can also help to reduce the uncertainty that often fuels the OCD symptoms. OCD is quite a challenge, but with evidence-based treatments like ERP and a commitment to self-management plan, recovery and significant improvement in quality of life are absolutely possible. If you or a loved one is struggling with OCD, please reach out to mental health professionals who specialize in the condition. You're not alone, and help is available. That's all for this short episode of Peace Unplugged. Join us for the next episode. In the meantime, I'm offering you peace and tranquility. Bye for now. If you enjoyed this podcast, please follow, like, and share. Thank you very much. Martin, Peace Unplugged.